Council President Todd Gloria says the three-stage anti-gang initiative presented by the city's Commission on Gang Prevention and Intervention is good, but he wants details on cost and funding. Here to talk about local gangs and the plan is my guest, former gang member and now member of San Diego's Gang Prevention and Intervention Commission, Bishop Cornelius Bowser. Welcome to Evening Edition.
Thank you. It's good to be here.
Now, give us a snapshot of gang activity in San Diego today. What are we looking at?
Well, you're looking at, well, you have the African Americans, or the black group of gangs, and then you have the Latino gangs. In Southeast San Diego, City Heights is basically where, dealing with City of San Diego, where most of the gangs are. The gangs today are more mobile. They're not just located in one, they have their side of town, but they're all over the place. So it's kind of hard to fix them in one area.
How many gang members are we looking at, and what's the age range?
Well, the age range is, I would say the average age is between 13 and 15, but they've joined the gang as young as 9.
Oh, okay.
Yes.
And there's, I had heard the police say about 4,000 or more than 4,000 members?
4,100 adults and 100 juveniles.
Okay. Now, the Gang Commission initiative that we're talking about, there was a strategy in there that starts as early as preschool.
Yes.
Would you highlight some of those key strategies for us, and why start so early?
Oh, okay. Well, one of the things I want to highlight for sure is that our strategic action plan is, it has been evaluated. It's a public health model that has been evaluated, and it has been researched. And so we focus on 3 areas, which is prevention, intervention, and suppression. In dealing with intervention, we basically, prevention, let me do prevention first. Dealing with prevention, we basically focus on preschool and after-school programs dealing with kids that are young, because if you're going to prevent, you have to get them before they get to that age they want to join the gang. So we focus on trauma-informed care, educating agencies about trauma-informed care, and also we're looking at collaborating with the county of mental health, not mental health, but human health services in dealing with the public health nurses when they go into the homes when mothers are pregnant or they have lost someone who through a homicide or some type of violent act, and they go in. So we want to be trained. We want to get community volunteers to be trained to get in there and start dealing with them at an early age.
And then that's the prevention, but also the middle section and the last section.
Yes, and then intervention is when we try to intervene in their life. So that's where you're really dealing with the gang members. You're dealing with trying to get in there and offer them job opportunities, life skills, work readiness, and also what we do through one of the community programs we have is called CAS, Community Assistance Support Team, where we get out there, we walk hotspots, crime, where high gang crimes are. We walk those communities, we knock on doors, we offer the community resources that they may need. We also try to connect with gang members, and we also do a piece with that gang intervention where we go to the hospitals and we, when the individual's been shot or suffered through a violent gang violence, we get in there and try to talk with them to try to interrupt that retaliation. How
is this a strategy in this new initiative? How is it different than what's already being done, either through the police department or the schools?
I would say that, because it's a more joint effort now. When you have community over here, law enforcement over here, and politicians over here, or the city council over here, we're bringing it all together.
Well, you mentioned that some of these gang members are as young as 9 years old. I
Yes.
believe that's like third or fourth grade.
Absolutely.
Why do these members, either young or older members, say that they join gangs?
Well, it's a couple of reasons. One is there's friends, but also you have to remember that gangs been in San Diego for over 47 years, and so it's sometimes a generational thing where their father, their uncle, their mom, their brother, their cousins are in gangs, and so that's what really attract them into the gangs. Some of them actually born into it.
Well, and the City Council definitely supported the plan, but they wanted more information on funding and paying. What types of funds and resources are going to be needed to pay for this plan?
Well, we're still evaluating and looking at that. We have some ideas of what we'll need and so on, but we're still putting it together. And so once we do, we'll give a report on that.
All right. Well, I want to let folks know that they can read the anti-gang proposal at
Yes.
our website, kpbs.org. Bishop Cornelius Bowser, thank you so much.
Thank you.